Here's something that will make your blood boil. While families across the Americas struggle with health crises, the White House just decided to slash millions in funding from the very organization trying to help them. The Pan-American Health Organization, PAHO. Think of it as the regional health guardian for North, Central, and South America, now faces a devastating financial blow that could cripple its ability to respond to health emergencies across the hemisphere. But here's where it gets controversial. The justification for these cuts might not hold water when you examine the facts. Timing that screams political maneuvering. On the Friday before Labor Day weekend, when most Americans were packing for their last summer getaway, the Trump administration quietly dropped a bombshell. They announced what's called a pocket rescission package, essentially a sneaky way to cancel funding that Congress had already approved. The total damage? A staggering $4.9 billion in international aid, with PAHO losing $45 million of that pie. But here's what makes this move particularly infuriating. The timing appears deliberately designed to bypass congressional oversight. Senator Susan Collins from Maine didn't mince words when she called the maneuver unlawful. Why? Because constitutional law requires that these rescission packages be submitted with enough time for Congress to review and potentially reject them. With only 45 days left in the fiscal year, lawmakers have virtually no opportunity to mount an effective response. And this is the part most people miss. Article 1 of the Constitution explicitly gives Congress, not the President, control over government spending. As Collins pointed out, any attempt to cancel appropriated funds without congressional approval represents a clear constitutional violation. Yet here we are, watching it happen in real time. The accusations that don't add up. The White House justification for targeting PAHO centers around explosive allegations of forced labor and human trafficking of Cuban doctors. Sounds damning, right? But when you dig deeper into the actual facts, the story becomes far more complex and arguably unfair to PAHO. The controversy stems from Brazil's Mais Medicos, More Doctors program, which launched in 2013 to address a critical shortage of physicians in remote and indigenous regions. Picture this. Vast areas of the Amazon rainforest and isolated communities where people might die simply because there's no doctor within hundreds of miles. Brazil desperately needed medical professionals willing to work in these challenging conditions. Cuba, which has built one of the world's most robust medical education systems despite decades of U.S. economic embargo, offered a solution. They would send experienced doctors to fill these gaps. PAHO served as an intermediary, helping facilitate the logistics and ensuring proper coordination between the two countries. Here's where the trafficking allegations get murky. Cuban doctors typically earned around $40 monthly in their home country due to the socialist economic system and ongoing U.S. sanctions. Through the Brazilian program, they could earn approximately $500 per month, a 12-fold increase that represented life-changing income for these medical professionals. Yes, Brazilian doctors earned roughly 4 times more than their Cuban counterparts for similar work. And yes, the Cuban government retained a significant portion of the earnings, with PAHO receiving about 5% for administrative services. But does this constitute human trafficking? Most participating doctors returned to Cuba satisfied with their experience, having earned substantially more than they ever could at home, while providing crucial medical services to underserved populations. The program wasn't forced labor. It was international medical cooperation with financial benefits for all parties involved. Why this controversy misses the mark? Here's what makes this situation particularly frustrating. PAHO's involvement in the Mais Medicos program ended completely in 2018. That's 7 years ago, when Brazil's then-President Jair Bolsonaro terminated the arrangement, accusing Cuba of human trafficking. The program restructured entirely. Today, under President Lula da Silva's administration, Cuban doctors still participate in Mais Medicos, but through direct private contracts that pay them salaries equivalent to their Brazilian colleagues. No PAHO involvement whatsoever. Cuban physicians now represent only about 10% of program participants, with Brazil prioritizing recruitment of its own doctors and medical professionals from other Latin American nations. So why is PAHO being punished in 2025 for facilitating a program that ended in 2018 and has since been restructured to address the very concerns raised by critics? The real stakes, what PAHO actually does. Let's talk about what's really at risk here. PAHO isn't some bureaucratic money pit. It's the health lifeline for 35 countries and territories across the Americas. When hurricanes devastate Caribbean islands, PAHO coordinates emergency medical response. When disease outbreaks threaten to cross borders, PAHO provides the early warning systems and technical expertise to contain them. The organization operates on a budget that has already shrunk dramatically from over $1.14 billion in 2022-23 during the COVID pandemic to a planned $762 million for 2026-2027. That's a 33% reduction in just 4 years, reflecting the immense financial pressures already squeezing global health organizations. But here's the kicker. The United States remains PAHO's largest single donor with an assessed contribution of $55.6 million annually. The country currently owes $78.5 million in unpaid contributions, representing the majority of PAHO's total outstanding debt of $116.9 million from all member states combined. If these funding cuts proceed, PAHO could face an existential crisis that would ripple across the entire hemisphere. Emergency response capabilities would be compromised. Disease surveillance networks might collapse. Health programs serving the most vulnerable populations could disappear overnight. A historical betrayal. Perhaps most ironically, the United States helped establish PAHO over a century ago as the Pan-American Sanitary Bureau. The organization's headquarters sits in Washington, D.C., symbolizing the deep historical partnership between America and regional health security. For decades, PAHO has served as a bridge between U.S. health interests and Latin American needs, facilitating cooperation that benefits everyone involved. The Trump administration's assault on this relationship represents not just a policy shift, but a fundamental betrayal of America's own legacy in global health leadership. Congressional Democrats have already threatened to reject any government funding compromise if these pocket rescissions aren't halted. With a potential federal shutdown looming on October 1st, the stakes couldn't be higher. The Cuban doctor context that everyone ignores. Let's address the elephant in the room. Cuba's international medical missions. Critics love to paint these programs as exploitative, but they conveniently ignore crucial context. Cuba currently has approximately 25,000 doctors working abroad in over 100 countries. These aren't just developing nations. Cuban medical professionals serve in Portugal, Spain, and have even worked in Ukraine during wartime. Medical expertise represents one of Cuba's few valuable exports in a world where U.S. economic sanctions have strangled most other economic opportunities. When natural disasters strike, Cuban medical teams are often among the first to arrive and last to leave. They've provided critical care in Haiti after earthquakes, in West Africa during Ebola outbreaks, and throughout Latin America during countless health emergencies. Is the financial arrangement perfect? Probably not. Should doctors receive their full market rate salaries? Ideally, yes. But in a world where U.S. sanctions make normal economic relationships impossible, these medical exchanges provide real value to both the doctors involved and the communities they serve. What's really at stake here? This controversy raises fundamental questions about America's role in global health and international cooperation. Are we seriously going to punish an organization for facilitating healthcare access to underserved populations because we disagree with the financial arrangements involved? The broader pocket rescission package reveals the administration's true priorities. Cuts to fair trade initiatives, worker safety programs, Clean energy projects, UN peacekeeping operations, and multiple international organizations that promote stability and cooperation. Meanwhile, PAHO staff members are quietly planning for different budget scenarios, unsure whether they'll have the resources to continue their life-saving work across the Americas. As one senior PAHO official admitted anonymously, "Of course we are worried and we're planning with different scenarios, but that's all I know for now." The bottom line, here's what this really comes down to. Should legitimate concerns about employment practices justify decimating an organization's ability to respond to health crises affecting 35 countries? Should past program structures that ended 7 years ago determine current funding decisions? And should constitutional processes be bypassed simply because it's politically convenient? The clock is ticking. Congress has until September 30th to respond. But with such short notice, their options are severely limited. The outcome will determine not just PAHO's future, but America's credibility as a partner in global health security. What do you think? Is this a justified response to legitimate trafficking concerns, or a politically motivated attack on international cooperation that will ultimately harm vulnerable populations across the Americas? Should the U.S. be punishing PAHO for programs that ended years ago and have since been reformed? And most importantly, what does this say about America's commitment to health equity in our own hemisphere? The answers to these questions will shape not just PAHO's survival, but the future of health cooperation across the Americas for generations to come.